Now this pathway is definitely going to pose a fall risk, okay? Especially for folks, well, let's use this walker here. Especially for folks with a walker. Remember we talked about needing 36 to 42 inches to get through here. You see this a lot with people with walkers. They kind of have to go sideways to get through things. And of course their balance is off anyway. So we're going to move this out of the way, move the table over, and create a nice open pathway. Let's go ahead and look in the bathroom now. About 58% of falls that happen in the home happen in the bathroom. So let's address the size of the space. First off, because it's so small, it's automatically making us more prone to falling. We want to address the issues from the shower. A lot of folks utilize the shower door as a grab bar. That is a significant hazard that's not meant to support the weight of a human. So we're going to take these out, and we're going to put in nice sturdy grab bars on the inside and the outside. In an ideal world, we would have a low or no lip shower. This is the real world, so we're dealing with a real situation here. So we want to have that grab bar to be able to hold on to for balance as we're getting into and out of the tub. Additionally, we're going to put a shower seat in so that the person that while they're bathing, they're able to sit. And we're also going to put in a different kind of shower head, one that's on a long cord so that it can be taken off and used in a much safer manner. And we're going to get rid of lots of these little bottles of things around here and use one central soap location. With the shower seat, that'll make this area much safer. We're also going to add a raised toilet seat because as we age, our quadriceps in our legs atrophy, and getting onto and off of the john is a risk. So we're going to go ahead and put in a raised toilet seat for us there. Because the room is small, having piles of books, magazines, bathroom reading needs to go or be put in a much safer location next to the john. Also, I noticed the rug here is one of those kinds that it's really easy to catch your foot on. So we're going to get rid of this rug, and we're also going to increase the lighting in this room so that it's really easy to see what's going on, and it'll actually help the room feel bigger as well.
Time to make a little noise.
Push it my way.
When everything is finished, things look brighter in the bathroom. There's the raised toilet seat, the seat in the shower, which now has a curtain instead of those glass doors, different shower head, and those grab bars. Things are cleaner and less cluttered all around the house, kitchen and living room. It didn't cost much money either, and it's a much safer environment for Shirley.
Yes, Roy's fallen and Janet's fallen, and I've known lots of people who have fallen, and it's a fear of all older people. I just consider myself very, very lucky.
As we've seen, when a person falls, it can be bad news. If you fall and call 911, paramedics will arrive at your door. Here's the spot where if you have something called the Vial of Life, it can make a big difference. Vial of Life is free. It's an envelope with a magnet on the back for your refrigerator. Now inside the envelope are two things. One is a sticker that you should put on your door jamb. If and when paramedics come to your door, they know to look for this sticker. They will then know to look to your refrigerator, where they will find the other item in the envelope. It's a profile that you would fill out. It has your name, date of birth, and any medical conditions or medications you want the paramedics to know about right away. Information that can help a paramedic or doctor make the right medical decision. And medical decisions must be made quickly after a fall.
When a senior person falls, it becomes a trauma activation. The paramedics are called and you're brought to the hospital, either the emergency department or the trauma room, for an evaluation. Because when you're older and you fall, you can injure your brain, you can break bones, you can break your spine, you can break your hip. It's a major problem and it can have lifelong implications.
One thing that can help is a medical alarm. Wear it on your wrist or around your neck. They're waterproof so you can wear it in the shower. Press the button and you're connected to an operator who can get help, as in this demonstration.
This is Response Link. Do you have an emergency?
Yes, I've fallen.
Are you hurt?
Yes, I'm hurt. I'm in my living room and I fell.
Shirley, help is on the way.
There are several different companies that offer the service. Typically, they charge a monthly fee. Obviously, you hope you never need paramedics, but if you have a fall or a medical emergency where you can't get to a phone, medical alarms can save your life. These alarms can help you recover faster because you usually get help within minutes rather than hours or days. But if you can prevent the fall or fall the right way, it helps. There really is a right and wrong way to fall and how to move after a fall. Here's a demonstration.
So we're going to bring our hands towards the head when we fall to protect ourselves. We're going to absorb the hit in as many areas as possible. Oh. So here we are. Brought the hands to the head, and what happened was I was able to absorb the fall in more than one area. So I felt it on my ankle, a little bit on the knee, a little bit on the hip, a little bit on the side, a little bit on the elbow. Instead of one big hit, I was able to absorb it. Then, if you are able to get up and you want to be able to get up, this is the process you're going to go by. If you're not wearing a button or you're not by a phone, you want to roll yourself to the side that hurts the least. Press yourself a little bit up. Take some deep breaths. If you can scoot yourself up using your upper body strength to a seated position. From there, you're going to scoot to a telephone, or press your button, or scoot yourself to your front door and call for help. Really important to have this phone reachable. If you want to try to get up, scoot yourself to your sofa or another sturdy piece of furniture. Two ways. If you can, get on a knee. You're going to use as much upper body strength as you can and take breaks all along the way. Press yourself up, bring your back foot forward, and push into your foot, rotating yourself onto the couch. Secondly, if that's not an option, press into, now you don't need two hands to do this. You can do it with one arm if you have one arm. Press yourself up as much as you can and rotate while you're doing that. Bring your foot up to your sofa and just relax.